continuing on with task 20. So we're going to do the next part of our urinalysis, which is actually getting ready to do a urine sediment. So I have all my supplies right here. I have 2 different centrifuge tubes. I have my urine sample. I have distilled water that I'll put into one of my tubes just to be a counterbalance for when I'm spinning down my urine sample. I have a couple of pipettes. I have my urinary sediment stain. A little hard to see the label because it's a little old, but I have my urinary sediment stain. I have a slide that's already been labeled with the patient's name, date, and species. And then I have a cover slip that we'll be putting over it as well. A pen in case I need it. So first things first that I want to do, I'm just going to take off the cap and just put it over to the side because we don't need it. And then I'm going to take the cap off of my urine sample and just pour the contents into this centrifuge tube. Okay, so we're just going to pour all of that in. Okay. And we're just going to stand it right there for 1 second. And then what I'm going to do is I'm going to fill up my other centrifuge tube just with some distilled water just to be able to balance out my urine sample. Okay, so I'm just going to compare the two just to make sure that we are balanced. I'm going to pour out a little bit because I filled it a little too much. And now, of course, I just need to add a smidge more. Alright, I do believe we're balanced out. Okay, so if you just want to see both of the tubes, the one in the left, I have my urine sample. The one in the right is just some distilled water to help balance it out. We're at a level, so they're going to balance each other out when spinning down. We're nice and level, okay? So first things first, we're going to take my balance and put it in this one. And then we're going to take my urine sample and put it directly across. We're going to close the centrifuge lid. And then, as per my manufacturer, our centrifuge spins at about 1300 RPM, which works for this because generally you want to spin it around 1000 to 2000 RPMs for about 5 to 10 minutes. So since our manufacturer says that this guy spins down at about 1300 RPM, we're going to spin it at 1300 RPM for about 10 minutes. So I'm going to take my knob and just put it up to the 10-minute mark. And just to play it safe, I'm going to set a timer for 10 minutes as well. I'm going to press start. Okay, so I'm just going to let my urine spin down for the 10 minutes. Once the timer goes off, I'll be back. And then we're just going to zoom in a little bit and we're just going to get our urine sediment slide set up. And then we'll take a look underneath the microscope.